All right, I'm going to go ahead and begin. I'm a neurologist. When I gave this talk for Dr. Stefani, I said it's an embarrassing time to be a neurologist. My son, in May of last year, developed double vision and a facial weakness. He was hospitalized for 3 or 4 days, saw 3 neurologists, had all sorts of tests, was diagnosed with ADEM. So I have not been in the MS world. I went straight into research for the last 25 years. And so I said, wow, great, they've made a lot of progress since I was a resident. Well, no, they hadn't. So in December, he then developed ascending numbness up to his chest, and he was diagnosed with MS. So I decided it was time for me to catch up on literature. And what I discovered was that no progress had been made. And it was my wife who said, well, you should be reading about this guy who makes ice skating rink devices. And I said, no, this is too crazy to believe, but she was persistent. And so here I am today. Basically, to jump the story forward, I went to the Hamilton conference that Mark put on, met everybody, spent several days with Mark in Wayne State, learned his method of evaluating the Haacke protocol, brought it to San Diego where I run an fMRI facility, so I had the same scanner that Mark uses, a Siemens 3T, that is also able to do SWI. And sure enough, we sent the images to Mark. Sure enough, my son had obstructions, so I found an interventionist. I found one that was very experienced, but did his stuff at a very small hospital that had a very weak neurology department. Arranged to have my son done. My son had severe obstruction of the jugulars and the azygos. All the symptoms went away, even symptoms, something called a Lermite sign, kind of an electric shock that goes down the back when you bend your neck. Also, his personality totally changed. He was really an asshole for several years there. We actually went all into group therapy together because he was just so inappropriate. He's now, a number of you, I believe, have spoken to Devin on the phone or by email. Just a totally different person, outgoing, easygoing, stress doesn't bother him anymore. And then my next challenge, of course, was to get IRB. This was right around the time that Mark was having trouble getting his IRB. Dake had been shut down at Stanford. So I decided I really needed to put on my Machiavellian hat and figure out a way to get an IRB. So I went to the same smaller hospital that didn't have a strong neurology department. And I came up with an IRB that was not confrontational, was not too fancy. And we were able to slide right through. So in June we got IRB approval. So now we've now done maybe 30 of the Haacke protocol, and we've done about 15 treatments with the IRs in San Diego. So I want to go through with you this literature. So the orthodox, what I was taught 25 years ago, and what the neurologists are still telling patients today, is that MS is an attack by the immune system on myelin, right? That's what autoimmune means. It means that the immune system thinks that myelin is a foreign substance and is attacking it, right? That's what we've all been taught. So let's just talk about that. First of all, the viral theory has not been validated. The autoimmune theory has not been validated. You don't sort of hear that when you're talking to a neurologist, but if you look at the literature, and I'm about to read you 2 devastating quotes from the literature, the medications are marginally effective. The neurologists pride themselves in their huge trials. Think about it. Why do you need a huge trial? It's because the effect is so small that in order to get enough power, you have to do huge trials. Right? It's not a good thing that you do huge trials. It's a sign of the weakness of the method that you have to do huge trials. And then it's dangerous, right? We know Salbury's dangerous, but all of them are. These medications, they call them disease-modifying drugs. These are immunosuppressants. They would use steroids if they could. Right? You can't use steroids chronically because of the side effects. So these are drugs that are basically trying to be like steroids, only with less side effects. That's what they're doing. They kill white cells. Right? That's how they're working. Right? So let me read you, this is from the main textbook. This is the main textbook on MS. I'm going to read this whole long thing because it's so devastating. The possibility of being in a primary infectious process with or without an associated autoimmune reaction has not been entirely ruled out despite repeated failure to identify a causative agent. Over the last 4 decades, at least 14 different viruses have been isolated from the brains of MS patients, yet none has been shown to be etiologically related causative. Cook listed 22 agents suspected of being related to MS, for which substantial evidence of a causative role has not thus far been appeared. This is from a prominent researcher at the University of Glasgow. This is published this year. These significant data seem to have been ignored by some who are willing to defend the theory that MS is an autoimmune disease mediated by immunopathological mechanisms, despite overwhelming evidence to the contrary. Studies of these agents showed that the inability to go beyond the 33% line raised the possibility the entire observed benefit is only a placebo effect. It can be argued that over the years, the autoimmune hypotheses have been harmful to a considerable number of patients. Basic studies on speculative immunological mechanisms are continually shown to be It is clear that modern research should move away from the autoimmune theory. So what is the Zamboni theory? The focus from the IRs, of course, is on the cool anatomy or the wild anatomy, right? And that's the problem, right? The venous system is so variable. Think about the veins that you can see on your arms. Everybody's veins are a little different. Even on your 2 sides, they're a little bit different. That's been part of the problem. That's why I never heard the word azygos in my medical training. We didn't care. It's like, who cares about the storm drains in your street, right? You care about the water supply in. You don't care about the drain. As long as it's not stopping up your toilet, who cares about veins? I think in general in medicine, part of the problem we've had is we just didn't pay attention to veins. They were sort of, the leftover stuff. So everyone is having to go through this education. The IRs are way ahead of everybody else. And I remember not so long ago looking at Mark's images, and I couldn't tell the jugular from the vertebral, from the external jugular. It was just very confusing anatomy. So that's part of the challenge we have. So that's the anatomy, but what's the theory? So what's he shown basically? He's shown that Doppler and MR venography have obstructions, right? Now the debate becomes, well, more than in normals, and so far that's still going on, right? Zamboni basically found 100%. Zavadanoff at Buffalo is sort of aiming more in the 55, 60%. This guy in Germany, his name is Dope. I mean, it's just not a great name, D-O-E-P-P, right? He found none for the reasons that Stefani mentioned. So there's going to be that issue, what percent is. So that's the first thing Zamboni is. He found a lot of abnormalities that no one expected. Then he treated some of them, and a whole lot of people got better. So that's the second debate. Well, how many are going to get better? How many are not going to get better? That's an issue that we're still going to have to figure out. What is the theory? So his theory, and I think this would be Mark's theory too, but we'll give him a chance to put him on the spot there. Backflow causes damage to the small veins in the central nervous system, which leads to leakage of red blood cells and iron into the central nervous system, which leads to inflammation. Now, I think that's the theory, but I don't really feel that theory has been really carefully articulated yet. But that's basically what my understanding is, that delayed flow is putting pressure on the venules. So you have arteries, arterioles, capillaries. Capillaries are so thin, literally one blood cell goes through them at a time. And then they widen, that's called a venule, and then they become a vein. So the MS, the neurological symptoms are not being caused in the neck. They're being caused in the central nervous system, in the cortex. So the big vessels aren't there. It's the venules in the white matter and the cortex. That's where the damage is being done. So red blood cells leaking. The endothelium is weakened. The endothelium is the lining of the vein. It's weakened. Red cells get through. Iron gets through, and then that incites an inflammatory response. I think that's reasonable, but that's not what my own theory is.